So you've indicated that you have pain in the low back at left SI area. When I pushed on the PSIS, you indicated that that was the area. You had a twisting injury and a fall. When you lay on your back, your left ilium is a little bit higher. Okay? And you have good posterior rotation mobility on both sides. Okay? Let's have you lie on your stomach. Now, when you're on your stomach, then the mobility changes. Okay? So I can rotate the right ilium forward. I can get some spring motion there. And on the left side, it's stuck. It's not moving. The PSIS is more prominent and it's inferior on the left, more towards the ceiling and more inferior. And then if we come underneath your sit bones, I can't spring it upward. I can do it on this side. Okay? Now I can spring it inferiorly. So this is what we call a posterior ilium. People think it's in the SI joint, but it might be the whole pelvis, and it probably is the whole pelvis moving in a manner that blocks movement on the left side and creates ligamentous tension and, you know, can create some noise deception, ultimately some pain. Interestingly, your sit bones, the camera might not see this, but your right sit bone is very close to your gluteal crease. The left one is about 2 thumb widths away. And I don't think that we're going to get complete symmetry there. I think probably your pelvis has developed asymmetrically, but we'll find out.
Okay.
We'll take a look at how you sit. After we restore motion here, after we resolve this posterior ilium, I'll take a look at you again down low. I'll make sure you don't have any other pattern going on in the pelvis. I'll do a bunch of different angles of spring testing. Then I'll test you in sitting, and it might be that a little foam under a sit bone or under a trochanter will give you a little more sitting comfort.
Okay.
We'll test you for that. The other thing I find in a whole body screen, go ahead and put your face in the face hole, I'll take that out. The other thing I find is that just scanning your body, my attention came to this part of your anatomy, and you told me that you injured the thoracic vertebrae and probably got a compression fracture. And what I find is increased muscle tone. And when I come to the 4th rib, what I think is the 4th, it could be the 5th, it could be the 6th, you know, it's deeper, okay? And I can spring that rib medially towards the vertebrae, but when I try and spring it away from the spine, there's no motion. So I think you have a twist of that vertebra, of that rib, in which it twisted normally through a normal range of motion, but got stuck. So it didn't come back to its neutral position. So that's easy to treat. This is easy to treat. I'll have you lay on your right side and I'll show you how I'm going to treat the left ilium. So I'm going to bend your hip up to about, you've got flexible hips, so I can go 90 degrees without getting further rotation of the pelvis. I push into the thigh through the knee and I pull the top of the pelvis forward. My elbow is extended. Now we have this closed system. And so now when I oscillate with my stomach, I'm just rotating your pelvis forward. There's very little weight on that joint, so it's very easy to mobilize it. And so I'm just doing 10 little oscillations, maybe a couple more than that, and that should be sufficient. Let's have you lie on your stomach. And now I can take up the slack and now I can spring that. So it's that easy. If you'll step off the table, I'll show you the self-treatment. We'll keep his face out of it. So yeah, so just come out there in the hallway. So now you'll feel me down here. The self-treatment for that, you're not going to do it today. I want you to come back tomorrow and I want to see how it responded without any further input. But after that, I'm going to teach you the self-treatment, which you lay down on the side of your bed and you bring both feet over to the right and the hips come over to the right. You keep the left leg in, and then you let it drop down.
Okay.
And it'll be suspended, but over time it'll just ratchet down. It'll stretch and release. It'll stretch all the soft tissues, and this is one of the best ways to self-treat that pattern and to keep it at bay. So we'll have you do this once a day for a week, and then once a week for 4 weeks, and as needed after that. It'll stay. It really will. So good. Keep filming, and let's have you come lie on your stomach again. And to treat that rib, I just capture it with a lateral force along the angle of that rib, bringing it towards me at about a 30-degree downward angle. So I'm just walking up, looking for that rib that doesn't move. And here we are, we're on it. So I'm pulling it down this way, okay? And I'm just gonna lean on that for 2 minutes, okay? So you can go ahead and stop filming here. Just push that red button on the far right.